So bone grafting is required when a patient comes in and they're missing teeth, or they have a tooth or teeth that are being removed, and we add bone to the area so that we eventually can add implants to the site. So bone grafts are needed to provide the support for implant placement. When someone loses a tooth, they're losing the supporting structure that supports the tooth, and depending on how long they've been missing the teeth or tooth determines how much bone is missing. We do a series of x-rays and sometimes 3D imaging to determine how much bone is missing, and from there we can determine what we need to do as far as bone grafting. So the bone grafting materials that we primarily use is human cadaver bone, and we sometimes will mix that in with the products from their plasma. So we draw blood and we centrifuge the blood, and we take some of the plasma components that have growth factors that help in the healing process. Most patients are good candidates for bone grafting. We review the patient's health history thoroughly. There's some medical conditions, there's some medications that may preclude patients from having a bone graft, but in most instances, bone grafting can be performed safely for most patients. So one of the things that we do commonly in the practice is something called a socket graft. So a patient comes in and they're having a tooth removed. In most instances, the tooth comes out and there's an empty space. Sometimes when that tooth comes out, we lose bone in the process of that tooth coming out. So a typical procedure would be to remove the tooth and do a bone graft simultaneously when the tooth is removed. Usually 2 weeks after that, the patient comes in and we remove those stitches. 3 months after that, we have the patient come back and we do what we call a cone beam CT scan. It's a 3D image to determine how much bone is there and treatment plan the next step, which is placement of the implant.